Hi, Stephen Hoffman with Princeton Acupuncture and Oriental Medicine, and welcome to Acupuncture Live. So today I wanted to talk to you about imaging. A lot of times I have patients come in with neck pain, back pain, and they'll bring their MRIs or they'll bring their imaging and x-rays and things like that and show them to me. And imaging doesn't always tell the whole story, all right? There have been studies done. One study that I read about had 1,200 people in the study, and these were all people who were asymptomatic, all right? So this means that they had no symptoms. They had no pain symptoms, and this was for a neck pain study. What the imaging that they did on these people who had no pain showed was that 87.6% of them had bulging discs, okay? A full 75% of people in their 20s had bulging discs. So the imaging showed that there should be a problem, but there was no problem. There's another study. This was done on 3,000 people. And the imaging showed that 80% of the people who were in their 50s had disc degeneration that showed they should have pain, they should have problems. 36% of those 3,000 had actual disc protrusions. All right, so it wasn't just degeneration or arthritis or anything like that. It was actual disc protrusions that should have been causing pain. So the imaging is not always a one-to-one correlation. Okay, we look at your imaging and you're in pain, and the imaging shows that this is the problem and this is why you're in pain. So there's a couple problems with that. One is that if you are treating something that isn't the cause of the problem, how effective do you think that is going to be? The other problem with this is it often perpetuates pain syndromes for people. People say, well, I have a disc problem, that's why I have pain. And it just goes on and on and on. I have a problem, and if you think you have a problem, oftentimes you do have a problem. So it can perpetuate a pain syndrome, and the people are getting no relief from any of the things that their doctors are telling them to do. And a lot of times it's because that's not the actual problem. So the great thing about acupuncture is whether you have disc problems or degeneration or arthritis problems or not, we can treat it, all right? So if it is a thing that is being caused, neck pain, back pain, that is being caused by disc problems or arthritis, we can treat that, all right? We can reduce the inflammation, we can increase blood flow, we can get the body to produce the specific hormones that will help modulate the pain and stop the pain signals going to the brain. If it's not a disc problem, it's not a degeneration problem, the acupuncture will help with that as well. So a lot of times when people bring me their imaging, I look at it and, it's important enough for them to bring in, but it doesn't matter to me all that much because the imaging isn't always telling the whole story with what's going on with the patient, and everybody's different. So if you're having a neck problem, if you're having a back problem, and whether you have imaging or not, give us a call, set up a consultation. We can help you with it. Thanks.